So we got this new device, the Pristine 5.0 from Remidio a few days back, and we realized that it really added a lot to our practice because it's very nice and portable. It's a small device. It has a very good interface on the iPad, and it is very user friendly. So our staff found it very easy to use. So the workflows and everything were good. So what stands out for us with the Pristine 5.0 is, first of all, the excellent image quality in true color, because these are true color fundus images, and the quality of the images and the resolution is actually excellent. There are hardly any artifacts, and I've compared it to several other devices in the market as well. So how this differs from a typical non-mydriatic fundus camera is that it gives you 116 degrees of field very easily. And why wide field imaging for us is very important is that if you're only imaging the central fundus, which means if you're doing only the disc and the macula, you're actually missing out on a lot of other potential things that you may not see. So for example, if there's a small BRVO, or if there's some diabetic retinopathy changes which are in the beyond the arcades, or if there are some equatorial lesions or retinal holes or tears or some patches, you will miss out those. So getting a high resolution view of the central and the mid peripheral fundus is actually very, very useful for doing a good diagnosis. In fact, we use this to also screen our cataract surgery patients where the view is possible, and also in some of our refractive surgery patients for a quick screening. And if we find any lesions, we typically get a full dilated retinal exam done for them. So our practice flow improved significantly once we incorporated this into our chain of patient workups, because it doesn't waste any time at all. Our technicians find it very easy to use, and the user interface is actually very good. So once they take the scans on this, and it's a very portable, nice device, it can actually be put into a small bag and it can be carried. For example, sometimes we go for our camps, it's not difficult, it just gets unpacked within like couple of minutes, and it gets assembled within couple of minutes, and this thing can be charged very easily with a charger. And the user interface is good. For example, if I want to see the images, and frankly the best part for me is that it also connects directly to our on the LAN to all our computers in every room for each doctor to be able to see the images the moment they are taken. And then you can also see the nasal retina quite well. These are sclerosed vessels. Now all these things you would probably miss the exudates if you were just doing a small central fundus imaging. So this is the central fundus. The disc looks really nice. So for our glaucoma patients, I really enjoy doing this, because and the patients can absolutely understand very easily, because when I see patients, I typically open their image and I can easily explain to them that this is what you have, and they are more easily ready to get their treatments done, and they have the more confidence that what we are saying is what is actually there, and then the treatment line becomes so much easier. We don't have to sit and counsel them or convince them about the treatment. And then of course this can take montage. So these images, this is the montage. You can club several images into one. This does it automatically, and it's very easy to do. So you can get a nice good view of the periphery and the central fundus in one image. So these montages have been a very, very easy thing to do for us, and very useful as well. So I think the workflow has improved significantly, and our technicians are not in a rush, because it almost takes only as much time as it takes to do the auto refs and the NCT, and maybe a minute extra beyond that. So I think it's an all-in-one device which really adds to your practice, and I love these devices which are able to help us treat our patients better and document everything and improve our patient experience and our patient flows.